Today is World AIDS Day, and today on Twitter, President Biden shared a photo of the White House with a red ribbon. He wrote, "We raise a red ribbon to remember how far we've come, the work that's left, and those who've been devastated by this disease, particularly the LGBTQ+ folks and people of color who endured the brunt of this epidemic instead of being seen." Today, the Biden administration announced a new strategy to end the HIV/AIDS epidemic by 2030. The 5-year plan will focus on collaboration in fighting the disease, addressing equity issues and the stigma and discrimination around HIV, and strengthening public health initiatives. So today we brought somebody in to have a conversation with us, someone who has dealt with this crisis, been on the front line, seen this before. Today is Rex Fuller, CEO of Center on Colfax, a community offering so many resources for the LGBTQ+ community in Colorado. Thank you for joining us.
Well, thank you for having me here.
Let's talk first about the time that has passed, a little reflection on this day. Walk us through just your perspective today, looking back over the last couple decades as we talk about this.
Well, I first heard about AIDS in 1983. And how long that's been and how dramatically everything has changed. Back then, it really was a crisis, and it was a crisis that in some important quarters was really being ignored. It's remarkable to see a message like just came out from the White House today, because that certainly was not the message that was being sent back in those early days. It was really around stigmatizing communities, primarily gay men in those early days, and it was an extraordinarily difficult time.
There was fear and hatred at times about the disease from the outside focusing in on it. It seems like that lens, at least the lens that most people view it with, has changed now. A lot of that has to do with what's happened as far as medicine, treatments, prevention, things like that have changed dramatically over these nearly 40 years now.
I think you're right that there has been a dramatic change. I think there's also been a dramatic change just in the level of acceptance of the LGBT community in general, and I think a deeper understanding of what actually HIV is and how it's transmitted. In those early days, there was no information, and people were really quite panicked. And I think combining that it was affecting a lot of gay men in those early days, I think that really made a toxic environment for a long time.
Can you talk a little bit about the idea of undetectable for the patient, for their partner, and why that's something we should be talking about?
Sure. Well, there's a number of really great treatments now available that weren't available years ago. So there are drug therapies that can now really get to the point where you're not able to detect the virus in a person's bloodstream at this point. There's also preventative measures that other individuals can take. There are some medicines called PrEP, which is pre-exposure prophylaxis is what it means to prevent the virus from taking hold, as well as other safe sex measures that one can take. We've really started to see dramatic reductions in the number of infections compared to what it once was.
And a lot of people take advantage of those preventative measures, right? That's a pretty well-known treatment now, or I'm sorry, preventative measure now. I hear PrEP all the time.
I think it's growing all the time, and there's been some really positive legislation that has made it much more affordable for many people. At first it was very expensive, but now it really is something that people can afford and have easy access to.
That's the road to here. What do you see on the road ahead?
Well, I think that we are going to see dramatic improvements, much as what the president said in that message. The high point of AIDS infections, I believe, was 2004, and we have seen dramatic decreases since that time, which is really a positive sign. There are other countries, specifically on the African continent, that are still struggling with it as a major crisis, but I think all in all, it's a much better situation than it was 30, 40 years ago.
It's an important day. We're going to talk about it a little bit later on with our Dr. Powell Coley as well, but it's good to see you again. Rex joining us from the Center on Colfax. It's always good to talk to you, and thanks for coming in.
Well, thank you very much for having me.